Since October, the Centers for Disease Control, CDC, said there is a risk of airborne transmission of COVID-19. On Friday, U.S. federal health officials revised its coronavirus guidance to acknowledge that people can get infected by inhaling very fine aerosolized particles carrying the virus. The CDC says that there have been instances when people were infected with COVID-19 despite maintaining physical distance from others. For example, if people spend a prolonged period of time, from 15 minutes to hours, in a space, the virus can linger in the air and infect someone else who walks through it. Or in situations where people are shouting, singing, or breathing heavily, that can increase the risk of transmission. Chief Medical Officer Dr. Sean Charles explained the revised guidance.
That COVID is airborne, it simply means that the virus remains suspended in the air on very tiny particles that can linger for a longer period of time and that can travel on air currents a longer distance.
The CMO says because of the new developments, it is imperative that Grenadians take the wearing of their masks seriously.
What does it mean for us? It means that persons need to wear their masks. Those particles need to make their way into the air. They do that when persons cough and sneeze and talk and sing and laugh without wearing a mask. All right, to combat the spread by aerosols or by airborne means, it means that persons have to wear their mask. So it means that the person in the room with you that does not have a mask, or the person who was in the room a short while before, if that person was infected and they put those aerosols in the air, they are the one that contaminated the entire room. All right, that is what it means. It means that we have to be more disciplined with mask wearing.
The CDC's previous guidance said infections were acquired mainly through close contact from person to person, including between people who are physically near each other within about 6 feet. But it did not specify the airborne threat of the virus. For GBN News, Beverly Tellisford.